In the year 1955, a patient comes in to Dr. John Todd, and the patient is experiencing things in distorted fashions. And at this time as well, Lewis Carroll's novel, Alice's Adventures in Wonderland, has come out. That is where Alice in Wonderland Syndrome starts. And I'm sure we're all aware today of the movie, but let's jump right on into this topic and why it is important to discuss today with the rise in cases. So I thought this would be a very interesting video because it does pertain to mental health, and also it is considered a neurological disorder. And since there has been a steady rise in cases, as of the year 2019, they've reported an extra 180 cases, and there's been a 30% increase in people at least experiencing some of these symptoms or even one of them throughout their lifetime. So let's jump right on into that. That's why we're going to be covering it, because with time, obviously, we have better testing and whatnot, but it's steadily starting to increase, but there are definitely things that everyone should be aware of on how to potentially avoid this due to things such as drug-induced psychosis, which can cause this at points. But also, let's do a brief overview first, and then we'll kind of look at some of the treatment options, because there really aren't any true treatment options, but there are different ways to approach this. So first and foremost, Alice in Wonderland Syndrome. So let's break this down to what, why, where, important, treatment. We'll go from there. So what is Alice in Wonderland Syndrome? As stated, discovered in 1955. It is a neurological disorder, and it is distortions of visual perceptions with changes in size, color, movement, external objects, etc. But in particular, body image size changes are typically reported the most and most significant. Also, external object perception change. So for example, with that swaying tree, the way you view external objects, seeing things micro and macro, bigger, smaller. And also your own body, bigger, smaller. And I'll get into this, but it's typically something, it typically, in children in particular, happens more so at nighttime. But the big takeaway from this is, once again, there can be drug-induced and non-drug-induced with this. And one of the symptoms that is the most common is distorted objects, or even distorted, that be the way you perceive it, or even the way you perceive your own body in regards to, for example, your hands. Let's say you see them at night and you think they're 6 feet tall, or your head being extremely big in the mirror. And in Alice in Wonderland, if you think about it, you've got all these wacky objects that are insanely big, they're distorted in different ways. So that's where it gets its name. Now, once again, it's technically a neurological disorder, but there is drug-induced psychosis that can go with it, in particular with hallucinogenics or LSD. Discovered in 1955, as we already talked about. Now, why? So this is the big thing. We're going to talk about some of the causes. There's many causes of this disorder. First and foremost with it, migraines are the most common. That's the most common cause of this, if it's not drug-induced, of course. Naturally happening would be through migraines. We also have infections, which we're going to talk about briefly, which it would be things such as mononucleosis or mono, which is a virus. Also seizures, in particular epilepsy, another one. Psych disorders. So what I mean by that is if you, for example, have major depressive disorder and you're taking, for example, which I'll talk about in a minute, SSRIs, and there was a study done that we'll talk about briefly in regards to Zoloft or Sertraline. And also with this, as I said, drug-induced psychosis, brain lesions as well, which would be things such as stroke or hemorrhage is a cause, and toxic or even like metal. Like if you've inhaled metal, you got that in your blood. Those are some conditions as well. Now you might go, whoa, what? How do you narrow this down? Well, that's with testing today. We can narrow it down, but there's no specific pinpoint cause. There's numerous causes, and sometimes, unfortunately, when being tested, if you're saying you're displaying these distorted images and whatnot, it might not be any of these at all. That's why it's something that should continue to be studied as well, because A lot of times they don't know the exact cause of this, and they wouldn't know how to proceed in treatment. But we'll go over some of that if that were to happen. Also, now where would this happen? Let's take it from this way. Let's just say it is, let's say epilepsy or seizures, or even let's start with that, or even migraines. Let's not do hemorrhages or strokes, because that's different. That could be a cause. But what part of the brain in specific, if you're not having an injury like a stroke or whatnot, or let's say even on drugs, what part of the brain it could be potentially affecting? The parietal lobe. In one theory with it, of course, is with it affecting your brain, being a lack of blood flow or oxygen to your brain could cause this. Also, really another big takeaway from this is your parietal lobe. I don't know if I said frontal, parietal lobe. And your parietal lobe is near if you think about it, it's near your visual pathway that creates visual and auditory hallucinations. So if you're having a lack of blood flow resulting in lack of oxygen, this could potentially cause this. Because if it's affecting the way you perceive things, visual and auditory hallucinations, that definitely could be an indicator. Also with this, which I'll just go in right now, which I didn't, another lobe it could affect is your, and this pen sucks, temporal lobe as well. They kind of go hand in hand together. Once again, sometimes if it's not affecting the parietal lobe, could be affecting the temporal, vice versa. They work together. But a big key takeaway, let's say if you have a stroke on even your frontal cortex, lack of oxygen, lack of blood. Remember, as I talked about intersections, kind of like with your neural pathways, you might have a stroke, let's say on your frontal or temporal lobe of the brain, area of the brain, but it's affecting, for example, your parietal lobe, which could cause this. Also, another another cause or area that could be affected is your retina, so your vision. So like a torn retina, which can cause things such as floaters. And these aren't, I know you might be going floaters, though there's benign floaters, but this would be if you had a flash of floaters in your vision. That could signify you have a tear of your retina, or even to your optic nerve. And always with this is too, if this is going on, there's a higher chance of lack of blood flow. So just in general, for your body, organs in general, they all require blood, rich, healthy oxygen to keep your organs working properly, and that's just functioning properly. So with this, thinking about your visual and auditory hallucinations and the way you perceive things, or even yourself, brain and your brain, but also even your spine too. Now, also, another area that it could be, as kind of going with what I just stated, lack of oxygen, systematic, meaning it can be they don't know exactly the cause. It could be happening because of your brain, because of your eyes, other parts of your body potentially, but systematic, and that would be for things, once again, that would be in a way too of like toxins you could take in, heavy metals, etc., etc. Now, one thing that's really important with this too, and these are kind of some key facts too before we get into some of the treatment. It's more common in children, male children. And by the way, let me get my other pen. Sorry. Male children. Also like and subscribe and leave a comment. However, it is becoming more common today it can happen obviously to males or females. In a study I read, it was an adult female, but it is happening more so today with more medications being prescribed, and also in particular more psych meds being prescribed, in particular SSRIs, or even things such as antipsychotics. If you do have a chronic or severe mental health disorder that affects your day-to-day life, you do have a higher chance of potentially developing it. Same with having seizures, epilepsy. So chronic conditions can unfortunately put you at a higher risk. But the big thing too that I wanted to put on this with it is also is how we talked about mononucleasis or EBV would be why with children and teenagers it can be a little bit more common is, mono is the kissing disease, but it is considered an STD, mono, It can be exchanged through fluids, through sex, blood, but with it, they have found that that is one of the viruses that actually provides, it has a bigger viral load than a lot of other viruses at points. And it has been shown to, and they don't know the exact reason, but it has been shown in studies and in some of the clinical references as well, that mono does present more times than not, in particular with children or or adults if you've had mono in your past. Like when I was younger, I had mono. That if I developed this, that could potentially be one of the reasons. So mono is one of the number one reasons, as well as migraines as well, chronic migraines. But yes, that's another part. So if you were to suffer from this or whatnot, if you're going through your medical history, make sure you tell your doctor all the different viruses or, infections that you've had or that you were tested for and you tested positive for, because that could play a role. Now, treatment. Obviously, first and foremost, you do testing to rule out specific causes or disorders. So, for example, as I said, seizures, epilepsy, drug-induced psychosis, brain lesions with strokes, hemorrhages, toxic metals. You do CBC. You do a whole complete metabolic panel. You'd be running blood cultures to make sure you're not in sepsis. You do the whole thing to just rule out, once again, anything that could potentially cause it. And also, this is huge with treatment. If you don't report any of this, but you're taking a psychiatric medication, so let's say you're taking an SSRI, which has been shown, if you stop that SSRI abruptly, and in the study it was a female, she was taking Sertraline or Zoloft, and she didn't taper off. She stopped it abruptly because she thought her anxiety and depression were doing better, and she was having at night brief flashes of seeing her body, seeing her extremities or her hands and feet as being like 4 times the size that they were. She thought she at some points was looking in the mirror, and she thought she was she was like 10 feet tall, things like this, and it came in flashes and bouts for her. And they ruled out everything in the case study, but the only thing they could think of would potentially be abruptly stopping the SSRI, which you should know in general, never stop any psych medications that you're taking long term without talking to your doctor and discussing this with them, because there's a broad spectrum of side effects that can happen if you do that that to this day is still being studied that we do not know about. That's the one fear. For example, medications are great and all, but the one fear that can come with them at points is we have all these new medications. We don't know all the side effects yet. Sometimes it takes 20 to 30 years down the road to really know some of the long-term effects from them. So never stop them abruptly. Never do. That was what I found from that study that I found that was interesting. And now briefly too, LSD use, drug-induced psychosis, drug-induced, so hallucinogenics in particular, LSD. Mushrooms or psilocybin were not actually found on that. It was really just LSD that can cause bouts of this. But the thing that can happen is you can have an episode of this, seeing your body distorted, which will eventually resolve, but it can lead to chronic psychosis with that, which in itself can be very scary, where it's hard for you to take care of yourself. So things like that's one thing to be cautious with, is sometimes hallucinogenics have their place. Obviously, they help people in things like, for example, like ketamine and whatnot in the medical setting. They're helping people with their depression. Sometimes with that, proceed with caution, because this is something that could potentially happen. And the big takeaway from it is, if you're having one of these bouts of the Alice in Wonderland syndrome, is it potentially leading to psychosis. And psychosis, sometimes it can be hard to get out of it completely, and that can be a whole problem in itself, as stated. Some other things I'll say, that how can you treat this if you're actively in it or helping a loved one? Hydration, because once again, oxygen is discussed. All your organs, your brain require oxygen. Staying hydrated will only help, because hydration status obviously is great, as I'm thinking, is great for your organs, great for brain health, taking your vitamins, obviously. Also, diet changes. So if you're noticing this and you've went from, for example, let's say carnivore diet to becoming a vegan to a vegetarian, make sure you let your doctor know about that, because that could potentially be a change. Because this is important, because this right now is starting to be studied more, with there being more of a rise in cases, even though it's not that much, it's not like on the rise yet, but it's something that they're starting to see slowly creep up. So always let them know if there's any, what I mean by diet changes, not from eating like really, really unhealthy to starting to eat very healthy, but like changing a dramatic diet from like all meat to no meat to veg, back and forth, vegetarian to carnivore, things like this. And also, one thing I would always encourage anyone would be having a blood pressure machine where you can also check your O2. You can also check your oxygen saturation, because if you have a very low oxygen saturation, anything even below like 90, given if you're not a smoker or whatnot, that's a little bit more normal if you are. If you're a smoker, that is, and you have COPD. But if you don't smoke and you notice your oxygen saturation is even below like 93 chronically and whatnot, that potentially could be a sign. And also, in general, if you think about it, if your oxygen saturation is low, your O2, once again, your blood oxygen levels in your body are not as high as they should be, which could only potentially exacerbate it. But once again, I know this is a random video, but I just want to do a quick video on this because it's something I've seen dramatically that has been more on the rise recently, and just because it's still rare, but also there's no treatments, and they don't sometimes know exactly what causes it. They have ideas, which we talked about, and where it's going on in your brain, but just in general, with more drugs being, in particular psychiatric drugs being prescribed, and also I forgot to mention things such as Topamax, which is a seizure prophylactic drug, that also has been shown to potentially cause it as well, where you're seeing things distorted as well. So with more drugs being prescribed, which help dramatically so many people with different disorders, from psych to medical, a lot of times we don't know some of the long-term effects, and that just in general with how we act in our environment as time changes, these are things that are potentially on the rise. And psych in general is something that is on the rise, mental health. So that's why we're going to cover once again a lot of different topics. I've got a couple other videos where I talk about rare disorders, but I just wanted to throw this out here because I was interested in it as well, and I saw just some generic info on it that I wanted to cover. But it's just, how can we apply this today to better our own mental health and just improve as individuals as well? Leave a comment if you have any questions about Alice in Wonderland syndrome. I don't know what the next video will be yet. We cover all things mental health as discussed, but like and subscribe, leave a comment. Have a great rest of the week. I love you all.